Communication actually is a main theme in our digital transformation. And when you look at healthcare, communication actually leads to a lot of negative outcome. And so that's one of the things that we absolutely wanted to nail and get right. And there are really three parts to that communication. You ask, what are the challenges? People-to-people communication. This has always been a challenge in healthcare. And we wanted to get away from pagers and lots of phone type of communication and move to much more modern methods of app-based communication, messaging, and so on. It changes the game when you get that right. So that was a big one. Another big one is around connecting people to systems so that they're alerted of what's going on. We know that as alarming, but for us it's not just alarming, it's really a much more coordinated and orchestrated workflow driven by systems that are giving you information that's going on with the patient.
Right.
Our space is very, very large. We have private rooms, we've got a very big space, and so you've got nurses that have to do a lot of walking, and we wanted to make sure that nurses optimize their time. Being connected to systems, to patients through communications, in this case, Mycos and the Unite platform, has totally reduced the amount of unnecessary walking around that they would otherwise do. It's reflected. It's reflected in our ability to deliver patient care at a ratio of 5 patients to a nurse, the same ratio that we had in our previous facility, but the space is 3 times larger.
Wow.
So it totally demonstrates how with good communication, you get incredible efficiency. We're now very much involved in getting nurses, communication, and doctors and care teams at large to be connected with the right information in the right context.